Hi everyone. Today's topic, we'll continue with the general anatomy introduction. The next topic is terms used in relation to trunk, upper limb, and lower limb. That is the terms used in relation to the regional anatomy. First, in the trunk, we use many terminologies like ventral or anterior or the front of the trunk. So this front part of the trunk as shown in this picture in the given anatomical position is called as ventral or anterior or front part of the trunk. Similarly, the back part otherwise called as the dorsal part or posterior part of the trunk. So anterior is front part of the trunk or anterior, and posterior or dorsal part of the trunk is back of trunk. Similarly, so what is medial? Medial is a plane which is close to the medial plane. Lateral is a plane which is away from the medial plane. So medial is a plane which is close to the medial plane. Lateral is a plane which is away from the medial plane. So as shown in the picture, any plane which is close to the medial plane is medial. Any plane which is away from the lateral plane, we use the term lateral. So you can see the regional anatomy of an upper limb and lower limb. So the term hand is not synonymous to complete upper limb. So hand regional anatomy has three regions. So this region is called as arm. This region is called as arm. This region is called as forearm, and this distal region, this inferior region is called as hand. So the upper limb anatomy, the regional anatomy of upper limb, we have three structures. This is arm, forearm, and this is hand. Similarly, the term leg is not synonymous to total lower limb. So the lower limb has three divisions in the regional anatomy. So this region is called as thigh, and this region is called as leg, and this region is called as foot. So thigh, leg, and foot. So similarly, likewise the upper limb, lower limb also, the regional anatomy is divided into three parts: thigh, leg, and foot. So if we want to use the term medial and lateral over here, we can use like this. So this border of the hand, which is medial to the medial plane, it is called, which is close to the medial plane, so this is called as medial border of the hand. Similarly, this border of the hand which is away from the medial plane, or sagittal plane, it is called as lateral border of the hand. Okay, border of the hand. So same terminologies we use for internal organs also. So here this is the medial border of the forearm, and this is the lateral border of the forearm, and this is the medial border of the arm, and this is the lateral border of the arm. So that was shown in the picture over there. And similarly, this is a medial border of the thigh, this is a medial border of the leg, and this is a medial border of the foot. And this is a lateral border of the thigh, this is a lateral border of the leg, and this is a lateral border of the foot. Yeah, so you can see there is difference in the medial and lateral borders of the hand and foot. They are opposite. For hand and foot, they are opposite. So they are exactly opposite in view of thumb and little finger in the upper limb, and greater toe and small toe in the lower limb. Yeah, so these terminologies you need to know in trunk at least. So the other terms like proximal or cranial or superior, which is something close to the head end of the trunk. So anything which is close to the head end of the trunk, for example, this arm is known to be the proximal part of the upper limb, and hand is known to be the distal part of the upper limb. Similarly, thigh is the proximal part of the lower limb, and foot is the distal part of the lower limb. So these terms need to be known to understand the gross anatomy. So proximal is something which is close to the head end of the trunk. For example, the arm of upper limb or the thigh of lower limb. Okay, distal or caudal, that is which is near to the tail end, or inferior, these terms are synonymous and is something which is we use to a structure which is close to lower end of the trunk, like hands are distal part of upper limb, foot or distal part of lower limb, as it is. So another terminology is like superficial and deep. Superficial is something which is close to the skin or towards surface of the body. Like superficial term is given to some structure which is just underneath the skin or just towards the surface of the body. Yeah, so deep is something which is away from the skin or away from the surface of the body. You can see, so it is a surface of the skin, or yeah, so if it is away from the surface of the body, we use the term deep. So these are very easy. Yeah, next, these two terminologies are very important: ipsilateral and contralateral. Very easy. Ipsilateral, same side; contralateral, the opposite side. So ipsilateral is on the same side of the body from the another structures. For example, if right cerebral hemisphere is involved and right hand paralysis occur, we call ipsilateral paralysis. Contra And similarly, if right side of the cerebral hemisphere is involved in some disease and left hand undergoes paralysis, it's called contralateral involvement of upper limb, or contralateral paralysis of the hand. So as it is, so ipsilateral is something on the same side of the body from another structure, and contralateral is the term we use for a structure which is opposite of the body from the another structure. So these are relative terms. So for example, these two structures are ipsilateral structures, okay, or these two structures are red, the two red structures are ipsilateral structures, that is right hand and right leg. Okay, so like right hand and left leg are contralateral structures. Okay, okay, because they are opposite in relation to their position, or in relation to their region. Yeah, so the next, the other two terms like invagination and evagination, these terms we usually read in embryology, because embryology, what happens is there are many palacodes, there are many swellings, there are many tissue growths to form the complete fetus, okay, during the course of development of the embryo. So the terms invagination is something which is a projection inside the structure. So if this is a given structure in the embryo, if some given structure in the embryo, we say invagination occurs, it means it is the projection towards the inside. Similarly, if the projection outside occurs, it is called as evagination. So invagination is a term we use for the projection inside, and evagination is a term we use it for projection outside. These terms are usually seen in embryology topics mostly. Next, terms related to upper limb. Again, we should apply the same concept for upper limb as it is in the trunk. So the term ventral, anterior or front. So this is the ventral, anterior or front of upper limb. That's it. Dorsal, this picture doesn't show dorsal. Dorsal is back side. So this one, dorsal, posterior or back aspect is called as this one in an anatomical position. These terms are given in relation to anatomical position. We need to keep that in mind. Okay, so if we are confused at any point of the time, we should just imagine the anatomical position, and then we need to apply the concept of these terminologies. So this is the dorsal, posterior, back aspect of the upper limb. This is the ventral, anterior or front aspect of the upper limb. So we need to imagine the anatomical position. Yeah, so again, as I already told, medial border, lateral border. Medial border is something towards the medial plane. So the little finger border is a medial border for upper limb. Okay, lateral border follows thumb here. Okay, lateral border of the forearm and arm. So lateral border of the thumb, lateral border of the forearm, and lateral border of the arm. So these together form the lateral border of the upper limb. Similarly, proximal is something close to the root of the limb, or towards the medial plane, or towards the cranial end. Okay, towards the cranial end, that we discussed there. Okay, so proximal is something close to the root of the limb for upper limb. So these terminologies are for upper limb. So like this arm is proximal, forearm, and then forearm is something distal, and hand is something more distal. Similarly, distal is away from the root of the upper limb. So this is the root of the upper limb. Yeah, so palmar aspect is this one. Okay, the anterior aspect is otherwise the palmar aspect for upper limb. Okay, this one is the palmar aspect, and obviously this is the anterior aspect, because in an anatomical position, front part is called as anterior part. So this is the front part. So palmar aspect is anterior for an upper limb. Okay, yeah, we are discussing that because for lower limb it is something different. Yeah, so for dorsal aspect of the hand, that is this one, back side of the hand. That is, what is back side? You need to remember the anatomical position. In the anatomical position, this is the front part, back part is the other side. So dorsal aspect or back of the palm is called as dorsal aspect. Yeah, flexor aspect. These are another new terminology is flexor aspect is, yeah. So the flexor aspect is nothing but the front part of the upper limb, and extensor aspect is back part of the upper limb. So yeah, the anterior or ventral part is otherwise the flexor part of the upper limb, and the posterior part is otherwise the extensor part of the upper limb. You need to remember this way. What is flexion and extension we will see in the next class in the movements of the movements related to regional anatomy. So the another thing I want you to remember regarding arm, forearm and hand, as I already told you, the term hand is not synonymous to complete upper limb. So upper limb has three parts. The proximal part of the upper limb, is called as arm. Something distal is forearm, which is more distal is hand. Similarly, in the lower limb, the posterior aspect, so this is the posterior aspect, the buttocks region, the thigh region and the leg region is the posterior aspect. Okay, the posterior aspect is otherwise the back of the lower limb. Anterior aspect is front aspect, otherwise the ventral aspect of the lower limb. What is medial border? Medial border lies along the toe or greater hallux. For here, it's a normal anatomical position. So you can see the greater toe, along the greater toe, there is medial border. But for hand, in an anatomical position, for a hand, towards the thumb, it is a lateral border because it is away from the medial plane. So that's what I said previously. So around the greater hallux, it is called as, or the greater toe, it is called as medial border. Okay, yeah. So lateral border lies along the little toe, and the lateral border along the little toe, the lateral border of the leg and the lateral border of the thigh. So medial border is medial border of the leg, so medial border of the thigh, medial border of the leg and medial border of the foot. That is the along the greater hallux or the along the big toe. So yeah. So next, yeah, flexor aspect is the back of the lower limb. Similarly here, because here why the flexor and extensor aspect are different from upper limb or lower limb. This is because of the difference in the rotation of the upper limb and lower limb during the embryogenesis. Okay, so the upper limb rotates laterally like this and lower limb rotates medially. Therefore these surfaces, which are flexor surfaces and extensor surfaces, became the opposite surfaces for upper limb and lower limb. Okay, so extensor surface is front part because the action called extension is related to front surface. Yeah, similarly the proximal is something which is close to the root of limb. So this is the proximal part of the lower limb, that is the thigh, and this is the distal part of the lower limb, that is the which is away from the root of the lower limb. So this is the distal part, which is foot. Yeah, again here the regional anatomy, thigh, leg and foot, as I told. So this is thigh, this is leg and this is the foot of the lower limb. Yeah. So next, the terms used in embryology. So we need to also know 4 terms used in embryology, like ventral. Ventral is nothing but front part. So it's a belly part. Ventral is always the front part. So it's a belly part. Otherwise called as anterior part. It's always anterior. Dorsal is related to back part. So dorsal is related to back part, otherwise called as posterior part. Okay, sorry, otherwise called as posterior. Back, posterior, dorsal, one and the same. Similarly, in embryology, we also read the terms like cephalic or cranial, which means towards the head or superior, towards the head or towards the superior parts. Okay, caudal is towards the tail or towards inferior. Okay, like inferior, synonymous to inferior. These are terms used in embryology. So that's it. So